Thanks for joining us this morning. We have 16 new cases of coronavirus in the state of Victoria. We have now 217 exposure sites as a result of these outbreaks. That's up from about 160 exposure sites this time yesterday. So growth in case numbers, growth in exposure sites makes a couple of points, I think. One, this is wildly infectious and moves really quickly. I think we all know and understand that. But two, the fact that we're finding people and getting to people as quickly as we are is just clear evidence of how hard our contact tracers and public health team are working, and I'm very grateful to them, and I send a message of support to them. They're doing an amazing job for all of us, and the fact that I can confirm that all 16 of those cases are linked to other cases we already knew about. Now, some of them will have been in the community for a period of time, and we'll come back to you with some further details around that. We're doing some work around exposure days across the entire positive group, but we are finding people very fast. We're establishing the links between them and other positive cases. So it is unfolding as we had hoped it would. That's not to say that any extra case is good news. It's certainly not to say that we would ever wish for people to be infected with this virus. Can I just also make the point that 53,283 test results were received today? That's a strong number, a very strong number, and I thank each and every one of those Victorians who waited in a queue, got tested and got their results in the last 24 hours. That's how we protect you and your family, and indeed every family. So we want to keep those numbers as high as we can. Any symptoms whatsoever, please come forward and get tested. We'll get your result back to you as fast as possible, and you will have played your part in running this outbreak to ground and us getting back to normal. Now, in terms of where we find ourselves vis-a-vis Tuesday evening, Tuesday midnight, it is too early for us to determine whether we'll be able to come out of this lockdown at midnight on Tuesday night. It is, I'm afraid, not the day for us to be announcing parts of regional Victoria being let out of this lockdown, if you like, or operating under different rules. And whilst we take no joy from the fact that there is a case in Mildura today, and that'll require a lot of work from our public health team, there is a case in as far away as Mildura, and Jerome can speak to that in a moment. That just confirms, I think, for all of us, if we needed any, that this moves quick, and a problem anywhere becomes a problem everywhere, unless you've got rules on that are hard and fast, and you have taken this as seriously as possible from the earliest moment. That is the approach that we have taken, and it is working. I just can't yet make announcements for what will be relevant and what will be able to be done safely, what will be possible, if you like, for midnight on Tuesday. The next 24 hours, obviously the next 48 hours, are critical in terms of that. As soon as we can provide people with greater clarity and any notice at all of any changes, then of course we will. But it is too early. Frustratingly, I know, it is too early for us to make those announcements today. Can I just, before I ask Jerome to speak to these cases and outbreaks, and then Brett will offer any commentary that you need, or we might just go to questions at that point, I think. Can I just thank every one of the many thousands of Victorians who are in ISO because of where they've been and who they've been with, many of which, the vast majority of whom, will test negative and will be able to be released from that ISO. But you're playing a really important part in keeping the rest of us safe and making sure that this strategy works. We'll provide you with all the support you need, and we are deeply grateful, all of us as Victorians, and indeed beyond our state, because the sacrifices you're making, the contribution you're making, is about avoiding lockdowns in every part of our country. So we do thank you. It is many thousands of people, and they are doing the best of work, and we're providing them with the best of support to get that job done. That, of course, includes some apartment blocks that are completely locked down. That's very challenging, but we're doing everything from assisting with dog walking to food and grocery shopping, getting medical supplies, all those things, and to CQV staff, public health staff, some of our partners in local government, everybody who's working with us, including those who are the subject of these orders. Thank you very much. It's only through that team effort that we're able to see, yes, more cases, but more cases that are linked, a very big test number, and outbreaks that are unfolding as we had hoped. Not that we ever want more cases, but we're not seeing new fronts open up. We're not seeing fresh chains of transmission become evident to us, and that test number is very high and important to keep it high. Before I throw to Jerome, my final message, apart from saying thank you to everybody who's doing such an amazing job, following the rules, playing their part, any symptoms any symptoms whatsoever, please go and get tested today. Don't wait till tomorrow. Don't put it off till Tuesday. Get tested today. We have opened extra test sites. We have longer operating hours for some of those test sites. We're getting results back to people well above 90% within 24 hours. We'll do everything we can to get you a result as fast as possible, but you've got to go and get tested if you've got any symptoms whatsoever, and please do it today. Don't delay, because in the time you delay, you can be in the company of others. They in turn can be in the company of others, and we just can't put all the pieces of the puzzle together as fast as we'd like. So please get tested and get tested as fast as possible. I might now ask Jerome to speak to some of the details around those 16 cases, and then the three of us are happy to take any and all questions you have.
Good morning, and thank you, Premier. 16 new cases today. That takes the total for the outbreak now to 59 cases here in Victoria. 14,000 primary close contacts, 217 exposure sites. It's an increase of 50 on yesterday. And as the Premier said, over 53,000 test results received. It's 100,000 test results over the last 2 days. And my thanks to all those Victorians who came out and got tested in the last few days. And of course, the testing crews that are making all that possible. I'll run through briefly the new cases and just an update on the exposure sites of real concern. We have 5 new cases today linked to the Miss Frankie's restaurant in Cremorne. That's the first 5. 1 staff member and 4 patrons, making it a total of 8 people associated with that restaurant who are now COVID positive. We have 4 new household contacts in the City of Hume exposure, again part of an extended family connection. So we now have a total of 10 cases in the City of Hume cluster, but those 4 new cases take us to 9 for today. We have 3 new cases associated with Trinity Grammar, 1 a student, 1 a staff member, and 1 household contact. That takes us to 12 for today. We have 2 contacts from Amy Park, from the Wallabies versus France game at Amy Park. Both were in the area of the stands of concern, sections 20 to 23, coming in through gate 7. We have sent a lot of messaging to people who were at the Wallabies game on the Tuesday night. I'd really urge everybody, please check and confirm where you were in that stand. If you came in through gate 7, if you're in sections 20 to 23, you must come and get tested and isolate. That takes us to 14 cases for today. We have an existing primary close contact of the group of friends who went to Phillip Island. That takes us to 15. And then finally, a teacher from the Bacchus Marsh Grammar, which takes us to 16 new cases for today. All existing exposure sites and areas of known concern. In addition, this morning, literally in the last hour, we have another positive case confirmed in Mildura. My understanding at this point in time, it's a man in his 30s who was at the MCG for the Carlton-Geelong game last Saturday, or Saturday before last. We're obviously working with him and his extended close contacts. My understanding at this point is he was in the level 2 of the MCC reserve, and will of course continue to share any other information we have during the course of today.